Hey Jordan, it is fantastic to see you today. Thank you so much for agreeing to come onto the HearingTracker YouTube channel and discuss your experiences with treating tinnitus. So thank you so much. Now, a huge number of people that tune into the HearingTracker YouTube channel are either interested in or suffer with tinnitus. So I'm very, very excited for you to share your wisdom and your experience and get some of your strong messages out there to help any of our viewers.
So, hey, Matthew, thanks so much for having me and giving me this platform today.
Thank you, Jordan. So, I think it would be a very sensible thing for you to do to start off with to share a little bit about yourself, what your role is, and what you're looking to share with anybody watching today.
Yeah, so that's a great idea. I'm a London based audiologist and hearing therapist, which means I have a focus on tinnitus, hyperacusis, and other oral phenomena. My role involves assessing and helping patients who experience any of the aforementioned symptoms.
So, you are then the perfect person for discussing what we're discussing today on this video. Now, one of the most searched questions on YouTube, and something that I know a lot of people watching this video will be interested in, is there a cure for tinnitus or a way that it can be prevented?
Yeah, so I mean, the simple answer is yes and no. So there are some useful tips to keep in mind that could help prevent someone from developing tinnitus. But first, I think it's important to start with a definition of what tinnitus is. So, tinnitus is the term that we use to refer to when a patient hears a sound in their ears that's coming from inside their body rather than outside. So, these sounds are often described as whistling or hissing, buzzing, and roaring noises, among others. And they can either be constant or intermittent. Some individuals will experience the sound in both ears or just one ear, and it could alternate ears. And others may describe the sounds as not being in their ears, but more of like an awareness in their head.
And Jordan, exactly how common is tinnitus?
Well, actually, an American cross sectional study estimated the prevalence of tinnitus in the US at 1 in 10, so approximately 10% of the population. Whilst the latest statistics from the British Society of Audiology, they suggest that approximately 13% of the UK population may have some degree of tinnitus. A cross sectional study by the Lancet suggested most people tend to describe their tinnitus symptoms as either mildly or moderately intrusive, with only a small percentage reporting a severe intrusion from their tinnitus.
So, my take home from this, then, Jordan, is that tinnitus is pretty common. And anybody watching this video will know that they're not alone when it comes to them suffering with tinnitus, then. And I'm particularly interested in the fact that you mentioned mild to moderate tinnitus as well. So, what does that mean in terms of their experience, perhaps compared to somebody that may be reporting more of a severe tinnitus?
So, yeah, that's a good question. So, whilst there's no way to measure tinnitus, really, as it's a subjective phenomenon, we, however, talk about tinnitus symptoms in terms of their level of intrusiveness. So, like how bothersome it is for a patient, etc. This is what we're referring to typically when we use terms like mild, moderate, or severe. And the way that we would go about trying to measure this is through using validated questionnaires, as well as the patient's intake history and their self-reported experiences. So, for example, some of the questions on the questionnaire might be things like, is the tinnitus disrupting your sleep, affecting your day-to-day work or day-to-day activities, hobbies, leisure activities, relationships, those types of things. So someone with severe intrusion from tinnitus might find that a lot of those categories are being impacted by their tinnitus.
So, I guess I also imagine then that someone's measure of tinnitus, with it being purely subjective, could significantly change then depending on how they're coping with it at that particular moment in time.
Yes, exactly. So if one is particularly stressed that day or not feeling great, or there are other sort of environmental factors, those types of things could affect how they're perceiving their tinnitus in that moment, and so change how they might be feeling about it.
Now, if you look online, there are plenty of different causes of tinnitus, but from your point of view, what are the most common causes, Jordon?
So that's also a really good question too. So tinnitus in and of itself is not an actual condition, but it's more of just a symptom. And so what this means is that tinnitus can be present if there is, say, some other underlying condition that's there. And that underlying condition isn't necessarily anything that's nefarious or even sinister. It could be something as simple as an ear canal that's been blocked with wax. And so for this reason, that's why I'd say that it's important to speak with your either audiologist or GP practitioner or healthcare provider so that they can carry out the necessary assessments and check for these types of conditions or rule out certain conditions and address them. And then for some potential causes that could, elicit tinnitus, that would include things like hearing loss, age, whether there's a history of loud noise exposure, some ear-related conditions like infections, middle ear infections or infections to the ear, trauma. Outside of the ear, you can have sort of muscle tension, head or neck injuries, tension in the jaw, anxiety, low mood, and then other conditions like diabetes or hypertension, and then certain medication use as well. So some medications that we might use to treat cancers, so chemotherapy or radiotherapy, as well as really strong antibiotics, or some over-the-counter medications like NSAIDs. So it's a very varied group of things that could have tinnitus as a symptom.
There are just so many things that can contribute towards tinnitus that you wouldn't even think about. Now, what tips can you personally share that can help somebody to avoid getting tinnitus in the first place?
Yeah, so let's get into that. So first on my list is hearing loss. Not all hearing losses are created equal, though. There's definitely a correlation between developing hearing loss and tinnitus. So what this means is that many people with hearing loss may report tinnitus, but not necessarily everyone who has a hearing loss will. That being said, it's still best to avoid hearing loss where possible. And I like to think of hearing loss in terms of, let's say, three groups. So you've got congenital hearing losses, presbycusis, and then acquired hearing losses. And so what I mean when I say congenital, those are hearing losses that were present from birth. And so they're most likely the result of genetic factors or development. And for this group, unfortunately, there's not much that can really be done in the way of prevention, okay? Just due to the nature of how they come about. But then for the second group, so that would be the ones with presbycusis. So presbycusis is just a really, say, fancy way of describing hearing loss that arises as a natural result of aging. Okay, so our hearing system is mechanical in structure, and through the years, experiences with wear and tear and things like that will eventually lead to a hearing loss. I say it's the price that we pay for longevity. And though one may not be fully able to avoid this, there are certainly steps that can be taken to help mitigate. So such as regular hearing health checks can help one to stay on top of their hearing health profile, and also get management such as hearing devices early on, which can certainly help to slow the progression of that hearing loss over time. And then the third group, this is the acquired hearing losses. So as its name suggests, these would be hearing losses that can arise from, say, like injury or trauma or disease to the delicate structures of our ear. And so, for example, that might include things like excessive loud noise exposure, So frequently attending concerts or listening to your music through your earphones really loudly. If you work with heavy machinery, so if that is really loud, or if you're engaging in recreational activities that has a really loud sound component to it, so things like, say, hunting, or maybe firing guns. In these instances, using hearing protection to limit the volume of sound that's going into your ears is going to really help to prevent damage from loud noise. So eventually, or rather equally, turning down the volume on our headphones, our earphones is a good idea. And then using things like noise canceling headphones as well too will work, because then that means that you're less likely to increase the volume to block out the environmental sounds, because the devices will be trying to do that for you. Typically what we would say is sound volume levels of about 85 decibels or more are usually what we would in the profession consider to be sounds that are loud and that put one's ears at risk of damage, and therefore the possibility of tinnitus. So aim to keep things below that volume, or say for like concerts where you might not necessarily have control, wearing hearing protection. And then also for some conditions like middle ear infections or cholesteatomas, that can also affect the delicate structures in the ears, which, like I said, can lead to tinnitus. Early detection is going to be key here, and then getting intervention as well to help improve the outcome. So again, that's why it can be important to speak with your audiologist or healthcare professional as well about these things.
Okay, so that's positive. There are lots of things that can be done then. So be mindful of loud volume and protect your ears with hearing protection, which sounds perfectly doable. Now, I do have one pretty loaded question for you here. Doesn't hearing protection sound pretty awful? I know that when I've tried it, it can sound sometimes a bit like I've got my fingers stuck in my ears and I feel quite blocked up. Music doesn't sound like anything that it should do. Are there any other tips that you might have?
So for my tip number 2, I would say filtered hearing protection is another way to manage this. I kind of alluded to hearing protection a little bit before this, but effectively the filtered protection provides reduction to the level of the music. And it does it in a way that aims to maintain the same overall sound quality and sound fidelity. And so it's not compromising on that. And taking this a step further, custom filtered hearing protection can be better, as the custom fitting helps to ensure that the acoustic seal is maintained. And what this does is it forces sound through the filter, and so that it can't really get in through the ear canal. Yes, it's very easy to acquire hearing protection. And I think making small changes like that can have a really big impact, especially if you're looking to try to prevent any tinnitus.
You've also mentioned mental well-being as a possible cause of tinnitus, or at least a contributor towards it. How would one address that?
Let's say poor emotional health can also be a trigger for tinnitus in some cases. So high levels of stress, anxiety, worry, they could also lead to poor sleep, and fatigue, which can further sort of trigger or exacerbate, tinnitus symptoms. The pressures of day-to-day life mean that it's not always easy, or always possible to avoid stress. But I think certainly trying to take steps or make time to try to reduce stress, and even incorporating certain exercises or activities that you like that help reduce stress can be very beneficial to helping to prevent tinnitus. So some of these activities might include things like mindfulness or physical exercise. Certainly, breathing techniques can also be a helpful way to reduce stress and anxiety. I would say, do try to explore ways that work for you. It's not everything will work for everyone, but it's certainly important to explore those avenues. I'd say the take-home message here is that you want to look after your emotional and mental well-being. as it can just help reduce the onset of tinnitus.
So far, that's two things that one can do that you've mentioned that can either reduce the risk of developing tinnitus or stop it from getting any worse or contributing towards it getting any worse. So, do you have any other suggestions? I mean, there's a lot out there online about either changing diet and looking at things like alcohol, caffeine, or salt in one's diet. I mean, is there any truth in this as well?
Hmm. Yes. So I think that's a great question. So let's get into that. So firstly, I would say here that it's important to make a distinction between any one food item and diet. So here, when I'm using the word diet, I'm obviously not talking about trying to lose weight, but more in the sense of the kinds of foods that are habitually consumed as a whole. So nutrients and macronutrients don't work in isolation in the body. And therefore, talking about avoiding any one food group or food substance is probably not very helpful. So I'd say for this reason, it's why, generally speaking, most of the literature would suggest that you don't have to avoid any one food substance or food to prevent tinnitus. The research does, however, suggest that there is a link between your cardiovascular health. So think like your heart, arteries, veins, those things, and your ears. So therefore, consuming a diet, I suppose, therefore, one could then say that consuming a diet that helps to maintain the health of your cardiovascular system or reduce the risk of cardiovascular disease would be something that would be recommended. And, incorporating regular exercise or staying active, those are some examples of things that could be beneficial to your cardiovascular health. However, I would suggest, speaking with your medical practitioner if you did have any sort of particular concerns related to this, or you were looking for more detail. And then on a similar vein, no pun intended, most of the literature doesn't really suggest that there's a causal link between tinnitus and caffeine. So I know that there are probably some people who are listening to this now, rejoicing that they won't have to give up their morning cup of joe. And similarly, with alcohol, there doesn't seem to be a strong link between it and tinnitus, or at least the studies that exist so far haven't been really showing that. However, I'd say as alcohol, especially in large quantities, can have secondary effects to one's cardiovascular health. It's possible that there might be like an impact via that route. So like cardiovascular system, and then that having an impact on the auditory system, and then tinnitus possibly following as well. So I think that, as with most things in life, food substances, food or otherwise, it's best to avoid excess. I think moderation would be key.
I mean, this stuff is really good, and a lot of it's obvious, but there's some things that you wouldn't naturally think about, and it's great that you're here sharing it today. So thank you again. It really is multifaceted, but good to know that there are quite a few different things that one can do to reduce the development of tinnitus. So just to quickly summarize, hearing loss can contribute towards tinnitus, and though there are some hearing losses that can occur that one can't control, there are definitely ones that are manageable and preventable, more importantly. One should be mindful of loud volumes, turning down the volume where possible, like on headphones or earbuds, and definitely using hearing protection when going to the likes of concerts, gigs, or even at work using loud machinery or equipment.
Yeah, I'd say that's correct.
And then the second thing that you've really mentioned is to look after one's mental health and well-being, and finding time to relax and make relaxation part of your daily routine. Trying to find ways to help one de-stress and lessen one's negative emotions as well.
Yeah, exactly.
And then finally, the only other thing you've mentioned is looking after your cardiovascular health through a healthy and balanced diet and plenty of physical activity and exercise.
Yeah, that I'd say that summarizes them quite nicely. So sometimes, despite our best efforts, some people can still develop tinnitus, but being mindful of the things we spoke about here that are within your control is the best defense one has to help ensure that they don't develop tinnitus, I'd say.
Jordon, we better wrap up this at some point. Otherwise, we'll be sat here chatting all day. Thank you so much for joining me today. I really hope that these tips and this advice will be helpful for any viewers and anybody that's worried about their tinnitus. Thank you so much for your time.
Yeah, no, it was my pleasure. Thanks very much, Matthew.